Doctors are healthcare professionals who diagnose, treat, and help prevent illnesses and injuries. Their main role is to assess patients' symptoms, perform medical tests, and recommend treatments or lifestyle changes to improve health. Depending on their specialization like pediatrics, cardiology, or surgery, doctors may focus on specific body systems, diseases, or patient groups. They play a critical role in promoting wellness and saving lives through evidence-based care. Beyond treatment, doctors also educate patients about healthy habits and preventive medicine. They work in hospitals, clinics, research institutions, or even run their own private practices. Many doctors collaborate with nurses, pharmacists, and other healthcare staff to deliver comprehensive care. Their job requires compassion, patience, and the ability to make difficult decisions that can profoundly affect human lives. Becoming a doctor is a long and challenging journey that starts with a strong foundation in science. Students typically complete a pre-medical or science-related bachelor's degree before applying to medical school. Admission requires excellent grades, recommendation letters, and success in exams like the MCAT. Medical school itself usually lasts for 2 to 6 years, combining theoretical study with hands-on clinical training. After medical school, graduates must complete a residency program where they practice medicine under supervision for several years. Some continue with fellowships to specialize in areas such as surgery, cardiology, or psychiatry. Finally, doctors must pass licensing exams to legally practice medicine. The path is demanding but rewarding, requiring both academic excellence and emotional resilience. Doctors need a solid education in biology, chemistry, and anatomy, along with strong analytical and problem-solving skills. Critical thinking is essential for making accurate diagnoses and treatment plans. Communication is equally important. Doctors must explain complex medical concepts clearly to patients and their families. Empathy, patience, and emotional intelligence are also key, as healthcare often involves dealing with stress, suffering, and difficult choices. From an educational standpoint, doctors need extensive formal training, medical school, clinical rotations, and residency. But beyond academics, lifelong learning is vital. Medicine constantly evolves with new discoveries and technologies, so doctors must stay updated through continuous education, research, and conferences. The best doctors balance scientific knowledge with human compassion. On average, it takes between 10 to 15 years to become a fully licensed doctor. This includes 4 years of undergraduate studies, 4 to 6 years of medical school, and 3 to 7 years of residency, depending on the chosen specialty. Some fields, like surgery or neurology, require even longer training before one can practice independently. This timeline might seem long, but each phase builds essential knowledge and skills. The early years focus on understanding human biology, while later years develop practical clinical experience. By the time doctors finish training, they're equipped to handle complex medical challenges with confidence and precision. The journey is long but prepares them for one of the most respected professions in the world. Doctor salaries vary widely depending on specialization, location, and experience. In the United States, for example, primary care physicians earn around $200,000 per year, while specialists such as surgeons or anesthesiologists can earn $400,000 or more. In other countries, income may differ significantly, but doctors generally enjoy stable and high-paying careers compared to most professions. However, income should not be the only motivation. Doctors often work long hours, face intense pressure, and carry great responsibility for their patients' well-being. The reward goes beyond money. It's about helping people recover, saving lives, and making a real difference in society. Still, financial stability is one of the profession's appealing aspects. Yes, being a doctor is one of the most challenging careers in the world. The training is long, the workload is heavy, and the emotional toll can be significant. Doctors often work nights, weekends, and holidays, especially during residency or emergencies. They must make quick, accurate decisions in high-stress situations where lives are at stake. Despite these challenges, many doctors describe their profession as deeply fulfilling. The ability to heal and comfort others gives a sense of purpose unlike any other job. The key to managing the difficulty lies in passion, discipline, and emotional balance. Doctors who genuinely care about their work often find strength in the gratitude of their patients. The advantages of being a doctor include job security, financial stability, and the opportunity to make a real difference in people's lives. Doctors enjoy social respect, continuous learning, and the satisfaction of saving or improving lives daily. They also have diverse career paths: research, teaching, public health, or private practice. On the downside, the journey to become a doctor is long and expensive. Burnout is common due to stress, heavy workload, and emotional exhaustion. Doctors must balance professional and personal life carefully. Yet for many, the joy of helping others outweighs the difficulties, making it a career of meaning and impact. A doctor's day usually starts early, with patient rounds, reviewing charts, and meeting healthcare teams. Throughout the day, they examine patients, order tests, prescribe treatments, and handle emergencies. Some doctors spend most of their time in hospitals, while others work in clinics or offices, focusing on preventive care and consultations. No 2 days are exactly the same. Unexpected cases and urgent decisions keep the job dynamic. Even after leaving the hospital, many doctors continue reviewing results or preparing reports. While it's demanding, every day brings the satisfaction of helping people recover or guiding them toward better health. Medicine offers vast and diverse career paths. Doctors can specialize in surgery, pediatrics, psychiatry, internal medicine, or emerging fields like telemedicine and medical AI. Some move into research, teaching, or hospital management. The healthcare industry is evolving rapidly, and doctors who adapt to technology will find even greater opportunities ahead. The demand for doctors remains strong worldwide, especially as populations age and healthcare systems expand. Future doctors may work alongside artificial intelligence and robotics, but human empathy and judgment will always be irreplaceable. The profession will continue to evolve, but its importance will never fade. Becoming a doctor is not for everyone, but for those passionate about science, healing, and helping others, it's an extraordinary career. It requires years of hard work, resilience, and emotional strength, but the sense of purpose and fulfillment is unmatched. Doctors directly influence lives and communities, making a lasting impact. If you are willing to commit to long-term education and selfless service, then yes, being a doctor can be one of the most rewarding paths you could choose. It's more than a job, it's a lifelong mission to care, heal, and inspire others through medicine.